Good evening, everyone. We'd like to welcome you to the live press briefing for the COVID-19 press conference here in the Cayman Islands, streaming live on Facebook, YouTube, and on government social media channels. We're going to go now immediately to a prayer from Reverend Alson Ebanks.
Shall we pray? Oh, that men praise the Lord for his goodness and for his wonderful works to the children of men. Sovereign Lord, we praise you today for your goodness and for your wonderful works unto the people of these Cayman Islands. Your mercies have been new every morning. Great is your faithfulness. It is therefore with thankful hearts that we bow in worship before you again today, O Lord, thanking you for your protection from natural and human-caused disasters. Thank you for preserving our people in the midst of this pandemic from serious illness and death. Thank you for giving insight and wisdom to those in authority so that they have continued to make wise decisions for both community-wide health and stability. May they recognize that, as the psalmist states, our God is a God of salvation, and to God the Lord belong deliverances from death. We now pray that you would continue to extend your grace and mercy to these three little islands that you have founded upon the seas. Guide the medical fraternity, the civil service, our parliament, His Excellency Governor Roper, as well as all those who are on the front line, so that we will continue to exercise wisdom and discretion as we carry out our necessary duties. Guide also your church, that we would remain faithful servants to our communities, incarnating the Spirit of our Lord and Savior Jesus Christ, as we exercise love and mercy to those in need. In Christ Jesus' name we pray. Amen.
Thank you. So joining us now live in the studio, we have on our panel His Excellency the Governor, Mr. Martyn Roper, along with our Premier, the Honourable Wayne Panton, and our Minister for Health, Ms. Sabrina Turner, and Minister for Tourism, the Honourable Kenneth Bryan. Also standing by to answer questions and provide input is the Chief Medical Officer, Dr. John Lee, and he will be calling in remotely, and also in the studio tonight joining us, representatives from the Health Services Authority, including the CEO, Ms. Lizette Yearwood, and also the Medical Officer for Health, Mr. William Rodriguez. And in addition to that, we have the Chief Executive Officer of Cayman Airways Limited, Mr. Whorms as well. So we're going to go straight to our panel now for the latest update on the COVID-19 situation here in the Cayman Islands. And we'll start with the Premier. Is that right?
I think it would be useful if we start with the public health folks, if they are online.
Okay.
With Dr. Lee and colleagues from the HSA.
Thank you very much. Okay, so we'll be going.
Good afternoon, everybody. This is really an update from yesterday. Yesterday, I reported a total of 49 contacts, and I'm reporting the vaccination status that I now have of those 49 contacts, where 29 were fully vaccinated and 2 were partially vaccinated. Additionally, we have the lineage of the 2 people who are positive, the index case and the relative to the index case, and they were both had the Delta variant, and I'm very grateful to the HSA's forensic laboratory for pushing that through the system very quickly, as I know it requires a lot of work late into the night. I think that the wonders of modern technology really do begin to show themselves when it's possible for a laboratory to confirm that it was the exact same viral strain that was in these 2 individuals. It's that accurate that we can look, and clearly that's how some forensic techniques look and define and decide decisions about matters to do with in the criminal sphere. Today, there has been a great deal of additional work being done in terms of contact tracing, and we have overnight discovered 1 further positive case that is related to the other 2 positive cases that we previously reported. We have also had a number of negative tests come in. So in all, we have had 49 negative tests come in and the 3 positives. The additional positive today has led to further contact tracing, and that will be a very active project that will continue over the weekend in order that we can go down all the different avenues of the different positive people and to collect up any possible primary contacts that these people have. I reported yesterday that there were some children involved who had tested negative. There have been no further children of interest or connections to schools that have been discovered today. So that is reassuring for us to hear. I think the one final thing I wish to say, which is not really about this case, but nevertheless is very pertinent, is that Public Health England today confirmed that they're happy for the UK Overseas Territories to proceed with a booster program because the boosters for both Pfizer and AstraZeneca have now been approved to be used by the Medicines, Healthcare and Regulatory Authority from the United Kingdom. So we will be rolling out that program as soon as we have confirmation through the Governor's Office and the Governor himself that the Foreign, Commonwealth and Development Office are happy to supply boosters to us and to actually give us a date. And when we have that date, we will be able to ask people to come forward for the booster program. But I expect that will start very imminently, and certainly we'll be calling forward people by priority. So the first group of priority will be those who are immunocompromised, and then it'll be the most elderly, and then working back through the groups. That information will come out over the next week or two as to how that will work. Thank you very much.
Thank you for that update, Dr. Lee. We will now go to the Honourable Premier, Mr. Wayne Panton.
Thank you very much, and welcome everyone. Thank you for a good afternoon, let me say, in addition to welcome. Thank you for taking time out of your day to be with us again. As you will have noticed, the timing of today's press briefing and yesterday's as well has been moved from the usual mid-afternoon session. As you can imagine, a critical component of these briefings is the most up-to-date information that we can obtain in terms of results and broadly related information from public health. And commencing these press briefings a little later in the day puts us in a position to have as much of this information as possible to share this with you. We certainly continue to appreciate the hardworking team at Public Health for all that they do. As you have heard earlier, ongoing contact tracing and testing efforts in connection with the community transmission case reported yesterday have resulted in the confirmation of one additional COVID-19 positive adult. Given the dominance of the Delta strain, we should not be surprised that these current cases include the Delta, and we're certainly grateful, very grateful, for having our own genomic sequencing capability and other world-class resources that we have invested in, which allow us to identify the variants of concern in our results. Again, all 3 positive cases are being very closely monitored, and all known contacts are in isolation. We thank everyone for cooperating and peacefully complying with our COVID-19 isolation protocols. I am very relieved to hear that so far no children have tested positive, and the children in isolation have been supported in their transition to remote learning. Being adaptable to ever-changing circumstances is essential for continuity at all levels in our education system. The Ministry of Education's COVID-19 guidance for educational institutions will be disseminated to all schools next week. I'll be inviting the Minister of Education back to update the country during our press briefing next week. Additionally, last night we all heard the unsettling news that a passenger was able to board a flight from Jamaica despite their pre-departure PCR test results showing them as positive for COVID-19. This was indeed very concerning, as you can imagine. While all systems are expected to work perfectly, there will be times that something does not go as expected. And yesterday, our system to allow travelers into the Cayman Islands was challenged. And after the positive test result was missed prior to arrival, it was one of our very own Customs and Border Control officers that discovered the anomaly, which also demonstrates the strengths and the redundancies in the system. I want to pause and sincerely thank that CBC officer on behalf of the people of the Cayman Islands for being on the front line, doing their job in an excellent fashion and protecting us all. The Minister for Tourism will speak further to the Cayman Airways incident in a bit. Both incidents have provided us with an opportunity to carefully review the performance of our COVID-19 response operations. And we have already started to implement updated policies and procedures to strengthen our systems. We continue to interface with public health and other relevant authorities to ensure that our plans to mitigate the increased risk of COVID-19 within the community are effective. Nevertheless, these incidents show us that we could be exposed to the virus at any time. So we must continue to take precautions by practicing good public health and safety hygiene, by wearing a mask, especially when indoors, washing our hands regularly, avoiding large groups as much as possible, particularly indoors, and underpinning all these measures, getting vaccinated. While I continue to be proud of the incredible work and sacrifices of our public service workers who have been on the front line of this pandemic since the beginning, it is unfortunate that so many of them, including our very own uniform services, have not yet received the vaccine. Many of these hard-working men and women on a daily basis face the very real risk of coming into direct contact with COVID-19 just by performing their duties, and as recent occurrences certainly have demonstrated. At the end of their shifts, they return home to family and friends who are then potentially exposed to COVID-19. As Minister Julie said yesterday, is there not a cause that's worth considering here and making sure that we consider the safety of our family and friends, ourselves, and our country? Please encourage your family and friends who serve in the uniformed services to take extra caution to protect themselves as they serve every day in protecting others. And so today, I am encouraged by and I want to recognize how quickly our people took personal responsibility for their health and well-being by increasing their safety hygiene practices over the past 2 days. We've seen more people protecting themselves by wearing masks and practicing physical distancing in public places. In addition to this, I want to thank and applaud all persons who stepped forward and got their first COVID-19 vaccination over the last 2 days. The community has turned out in strong numbers to take up the vaccine, which offers the greatest possible protection for our health against COVID-19. I congratulate and sincerely thank you all for taking that step in protecting yourselves, your loved ones, and our children. Ladies and gentlemen, the tough lessons and experiences we have endured this week serve to focus our attention on making sure that we take advantage of the opportunities to take this global pandemic seriously, practice public safety measures at all times, and get vaccinated. Thank you very much.
Thank you, Honourable Premier. So we turn now to His Excellency the Governor.
Yes,
Martyn Roper.
thank you very much, and good afternoon, everyone. I think the report from Dr. Lee was good news, very reassuring to hear that. Just one additional positive case and a lot of the negative results from the contact tracing and the isolating. So I think that is very good news, and good as well that a lot of the people involved have been vaccinated, because I think the vaccine will help us handle this, so that is really very welcome. And my thanks also to Public Health. They've been doing an incredible job dealing with this and getting out and about and doing all the contact tracing. And yesterday really was a very important test run for something which I think we are going to have to get used to happening and more often in the future. Fully support everything the Premier said, and particularly given that we still have an element of uncertainty at the moment. Sensible precautions, hands, face, space is a good way of categorising it, and I think that's really important that everyone does that. Good as well to see the vaccination rates are going up. That's extremely encouraging. And as Dr. Lee said, really good news about the booster programme, and discussions are already underway about how many booster shots we will need to bring in. But we will be able to start that programme very soon, and it has been accepted by London that we do boosters here in line with our own needs, not following identically the UK programme, because our situation is different, as I explained yesterday. A lot of people are asking questions about the 5-day quarantine and what will happen on 14 October, and I absolutely understand that, and it is a very difficult decision for the Premier and his ministers. I think, as I've said before, big focus of the Deputy Governor and myself is ensuring that the necessary policy advice and medical advice is there to enable effective decisions to be taken, and that advice comes from the Civil Service, from Dr. Lee, but I'm also pleased that on Monday we will be having a Zoom for Cabinet with 2 leading medical experts from Public Health England who have been dealing with overseas territories who've had difficult COVID outbreaks. So I hope that will be helpful in supporting that decision-making process. So in conclusion, I'd just say that the situation is fully under control. We all need to remain calm. There's absolutely no need for any panic buy-in that's gone on over the last day. We're probably in as good a position as any country in the world to be dealing with COVID, particularly given our very high vaccine rates. And as the Premier said, the best way we can protect ourselves is for even more people to come forward and get the vaccine. So please do come forward and do so. Thank you very much.
Thank you, Governor. So now we will turn to our Minister for Health, Honourable Sabrina Turner.
Good afternoon, everyone, and thank you, Simon. Great to be here this evening, and I want to first of all thank and express sincere gratitude and acknowledge the public health staff and all of those who have been on the ground in the past 24 hours, literally, out in the fields and definitely getting all their contact tracing information. And I would like to ask for the persons out there who have been in contact with any of these persons to aid and assist our public health staff to share the information so that we can definitely get to the root of this and mitigate all risk for any further spread. Your full cooperation is something definitely that will help us deal with this situation, and that is one public plea that I am making to every single person to assist our public health staff. There have been cross-ministry efforts given to the public health staff, and I want to publicly thank all of those persons from Travel Cayman. And I can assure you that this government is willing to support and extend any resources and manpower to public health in order to help us get this under control. What I want to plead to our people, the Cayman Islands this afternoon as we enter into this weekend, that you adhere, which I've seen so much, and I repeat some of the statements of our Honourable Premier, in asking people to take personal responsibility, avoid large crowds. We're not in the position and do not plan at this time to mandate, but we know that our people are responsible. We have gotten the statistics and the data that has proven our high vaccination rates in comparison to some other jurisdictions. And for those jurisdictions who are vaccinated and those who have fallen ill, seriously ill, it is proven that the vaccine works. We know that yesterday evening in the constituency of West Bay that we had a very large showing. A total of 229 persons were vaccinated. Of those, 209 were first dose and 20 were second dose. We know that those vaccination clinics continue today at Cayman Bay, and from what we're seeing, people are showing up in their numbers. We want this to continue, and we appreciate your cooperation in making this a reality. Talking about statistics, and for what we have seen, pretty much to confirm the importance of getting vaccinated and getting vaccinated as soon as possible, where the British Virgin Islands can confirm that they have had approximately 2,642 infections. 37 of those were corona-related deaths. But what we need to drive home to each and every one this evening is that out of 37 deaths, 2 were partially vaccinated, and the remainder were unvaccinated. But I would like to drive this home. What's particularly important is that no fully vaccinated deaths were recorded. Bringing it to the Bermuda, they began their vaccination program in January, and what we can see, the statistics are definitely aligning one and same. Of those, 116 were unvaccinated, 12 partially vaccinated, and 5 who had received the jab, but 22 deaths attributed from the virus, and 19 of those were unvaccinated. These are key statistics in our message, and that's why your government is here before you, making sure that we're open and we're encouraging and we're doing our part in making sure that our people are protected. Should you have any flu-like symptoms, we are encouraging you to not go to the HSA. Contact your local physician or give the flu hotline that is open 24 hours a call. Their number is 947-3077 or 1-800-534-8600. That is my plea to you, Cayman, Cayman Brac, and Little Cayman. Adhere to the policies, keep yourself safe, avoid crowds as much as possible, and if you have to venture out, please use a facial mask. Stay safe, Cayman, please, and go get vaccinated.
Thank you very much, Minister Turner. We now turn to our Minister for Tourism, the Honourable Kenneth Bryan.
Thank you. Good evening, everyone. As Minister of Tourism, my contribution this evening will be related to the unfortunate allowance of a passenger testing positive to be allowed to travel on the Cayman Airways flight to Grand Cayman last evening. And secondly, to update you on the Miss Cayman Universe event that is scheduled for tomorrow. I'm starting with the Miss Cayman Universe event. Unfortunately, the ministry and myself and my government have decided that out of an abundance of caution that we will postpone that event tomorrow night. Now, I want to say apologies to the contestants and the committee members and the many family members who I know were hoping very much to have this event tomorrow, but out of abundance of caution for us all, that until we know all the details surrounding the current incidence of positive cases, we will postpone that and have an update later on. In respect to the incident that allowed a passenger to aboard the Cayman Airways flight yesterday, I want to ensure the public that this is a very unfortunate and regrettable incident that concerns me as minister. And after talking with the board and the CEO, procedures and precautions are already being put in place to ensure that this doesn't happen again. And to give you a better understanding of what transpired, I've asked the CEO of Cayman Airways, Mr. Fabian Whorms, to give you an update on what protocols are currently in place, what new ones have been put in place from last night, and also what procedures normally happen when somebody travels to the Cayman Islands. So I'll ask Mr. Fabian to give you a bit of a background so you can feel a little bit more comforted to ensure that this doesn't happen again. Mr. Fabian?
Thank you very much. Yes, Mr. Fabian Whorms, CEO of the Cayman Airways Limited.
Thank you, and good evening, everyone. Let me start by saying that we have processed well in excess of 10,000 passengers to date in terms of screening their PCR test results prior to entry to Cayman. And it's something that Cayman Airways and its handling agents treats with the due diligence that it deserves. And we're very surprised to have found that a situation actually arose where someone boarded the flight with a positive test result. The system that's in place in Kingston is that when you join the queue, join the line, your documents are checked, including your PCR test. And it should show that you have a negative result. And then when you get to the counter where you have all of your other travel documents verified as part of the check-in process, it's also checked again. As to how two very thorough checks could have become compromised, this is what we have to investigate. And we can think of a myriad of possible things that may have happened, but we're not in a position to speculate at this point. For us to even investigate it properly, it involves receiving certain information in terms of maybe names of the persons that may have been affected and so on. And there's certain protocols that we have to go through before we can receive that information and put it to use. So we've been working with the various authorities, CBC, Public Health, etc., to get that information so that we can get to the bottom of what exactly happened. So I suspect possibly within a day, maybe by tomorrow, we should actually know what happened. Irrespective of what happened, though, we have immediately put some measures in place. So we had 2 checks, we've introduced a third. And in introducing the third check today, we found that there were some difficulties because that third check of the PCR test result, in the cases where people had the PCR test result on their telephone, when they're at the gate prior to boarding, which is where we're doing the third check, we've been finding that there's some issues with people not having access to Wi-Fi to display that. So we've come up with some alternate ways to address that. So we've also introduced some special forms. So I'm very positive that this will not happen again. It should not happen in the first place, and there's no reason for it to happen again. So we will do our best to make sure it doesn't happen.
Thank you, Mr. Fabian. And just to add a few bit of details that I know the public would be concerned about is that the passenger in question is in quarantine along with her companion that she was traveling with. They have been tagged with GPS tracking for the period of until she becomes negative, and all the protocols in respect to safety for all other passengers has been taken into consideration by public health. And I'm going to give more details and updates as to that investigation in the near future. Thank you.
Thank you very much, Mr. Whorms and Honourable Bryan. So now we have a panel of journalists standing by to ask a series of questions, and I think we'll start with Mr. John Fleming from Real Cayman News, if you're ready. John?
Thank you, Simon. You can actually just move on. There's no questions for me today. Thank you.
No question today.
He doesn't have a question at this particular time. Okay, I think we may call on Andrel Harris from the Cayman campus to ask some questions now.
All right.
Thanks, Andrel.
Thank you. My first set of questions pertain to they're to Dr. Lee, and they relate to yesterday's announcements as far as the patients are concerned. Would it be possible to get an update on the status of the patients, all the patients that were placed into isolation?
There would only be one person that we classify as a patient in terms of they are sick and requiring medical care and were admitted to hospital. The other people are managing on their own at home in isolation. That person doesn't actually have symptoms related to a respiratory illness and is doing very well. So they're very stable and doing fine, managing, breathing on their own.
Thank you. Perhaps you, Dr. Lee, or even the governor might be able to take this next one. Can we get an update on the total number of vaccines that are still available and when we foresee the next batch or arrival of the next batch of vaccines, please?
In the fridge. We have not actually had a confirmed date. The government may obviously be able to provide more information, but I have not yet had a confirmed date about the next delivery. We, at our current rate of consumption, when I last calculated, I still had about 7 weeks worth of vaccines left to go. Obviously, with the introduction of a booster program that will be coming very soon, that will change. And that's why we are in current communications with the FCDO about when they may be able to send the next shipment and what size of shipment that would be.
Sorry, yeah.
I think I can just to add to that we're in touch with London about the future supplies, particularly of the booster doses, but we've only just got that news today that it's really going ahead, so we need a little bit of time to pull that together. But I know London are already looking at flight schedules, so we will be getting the boosters that we ask for, and Dr. Lee will need to work out with his colleagues exactly how many we want to ask for initially. I understand there were 6,000 doses left earlier this week, so there were still enough vaccines on island to vaccinate 3,000 people. But if we go through those, we can get more. So as soon as we have clearer information, we'll put that out.
I see. Perhaps either Minister Bryan or the Premier might be able to take this question. Whether or not the passenger sought to enter Cayman through nefarious means, the reason behind their decision to board Cayman Airways and arrive in Cayman having tested positive is obsolete, so much so as what happens to the next person who knowingly boards a flight and tries to come to Cayman? What regulations, if any, will be put in place to deter people from attempting to do something like this going forward?
Just to inform you that the CEO has given indications that he will be reaching out to the Royal Cayman Islands Police Service to do an investigation, as there may be some breaches as to the regulations locally for intentionally trying to come to the island. So until he does his part as the CEO, I can give updates later on, but I know that their intentions to investigate that violation, and hopefully it sets a precedent as to anybody else trying to do it. At this particular point, we don't know if it was a mishap or an intentional move, but it is against the law. So we're taking it very seriously, and hopefully I can give you more details in the coming days.
Thank you. Yeah. And just for the sake of clarity, the question was more so towards future offenders as opposed to the current situation.
Can I add in on that? Currently in public health regulations, it clearly states that unvaccinated persons cannot enter the jurisdiction with positive PCR testing. So there is legislation already in play. So it's now for those persons using the legislation, the laws, in order to investigate it thoroughly and to find out, when they reach a point, whether any charges will be filed. But everything has to be investigated.
Okay. And Minister Bryan, not to labor the point, but with additional flights or airlines set to come on in, will these procedures or these policies be in place for them to adhere to as well? Will they be required to put in place stringent protocols?
In respect to across the different countries other than Jamaica?
Yes.
Yes, obviously we're going to try to do everything that we can to strengthen the safety net that we have in place right now. And the good opportunity that if there's any good that comes out of this situation is to see that where our fences are weak in our protective system. So what happened in Jamaica, can we examine now what happens in Florida or in the UK? And I can promise you that I've spoken to the board chairman, and his intention is to examine all gateways to ensure that nothing like this happens, not only in Jamaica, but any other gateway.
I see. Minister Panton, I want to just make sure I got the phrasing of this one right. Bear with me 1 second.
Does that mean it's a trick question?
Some might say. Now, has the Cayman Islands government done a cost comparison between the projected net gain from fully reopening the borders during, say, 2019, where there is, with no quarantine, and the cost of a large COVID outbreak that is likely with so many visitors potentially foregoing quarantine and entering the community?
Sorry, just repeat it for me one more time.
Will do.
And speak a little bit louder, because you tend to speak quietly.
All right. Has the Cayman Islands government done a cost comparison between the projected net gain from fully reopening the borders with no quarantine and the cost of a large COVID outbreak that is likely with so many visitors foregoing quarantine and entering the community?
Right. We certainly have done some preliminary assessments, and those are ongoing to basically sort of calculate for us what the potentials are in terms of reopening and what the costs are going to be. So those are the types of things that we're looking at. We don't know. We'd have to create different scenarios to ascertain what the different costs might be in terms of having a COVID outbreak. I don't know that we have specifically looked at that, but that's something certainly that we can consider. But we're certainly using information and using our Economics and Statistics Office and the Ministry of Finance to help work out and balance the various interests in reaching a conclusion as to whether we actually go forward or whether we put the brakes on. Of course, factored into all of that will be the realities that we observe around us, what's happening in the country, and obviously the significant views of the people of the country in terms of this proposed phase 4 reopening.
Thank you. Minister Bryan, can we get an update on the COVID prize drawing? Where are we with that?
Unfortunately, I can't give you one directly because the placed donor, the DMS group, are officially in control of the proceedings with that. So I haven't been given a full update, but I did speak to one of the primary stakeholders who said that I think you have to be fully vaccinated with 2 shots by the 14th. So I suspect the drawing will be sometime after the 14th in order for that to happen. And my last update I got, it was 100,000 one-time giveaway, and I think they were doing some giveaways every week. And I think everybody will feel better now with all those vaccinations that they're taking. They'll get a chance to win some money at the same time. But I'll ask the DMS group to give me some full details to have it available for you at the next press conference.
All right, 2 more questions. All right. Premier Panton, it has been noticed that while several of your colleagues have joined, there have been a few who have not been present at the majority of these meetings. One such person is the Deputy Premier. Noticed absence in his presence and voice. Is there discord there? does he not completely support this plan?
The plan, the reopening plan?
Yes.
No, of course he does. He has been present at least, I think, 2 of the press briefings we've had over the past few months. The most recent press briefings that we have had relate specifically to tourism matters, to public health matters, and obviously the governor or His Excellency and myself being present. We've had the Minister for Education being present because it related, there were concerns relating to schools, and possibly school children were involved in the testing and potentially exposed to, or potentially contacts of positive people. So those are the relevant people have been here. The fact that not all members of the government have been present and the Deputy Premier may not have been present for everyone is absolutely no indication that he does not support the overall reopening plan. Now, we, as we have said, we've got to go through a process of assessing how we're going to move forward, whether we make a decision. That's something that we will all be engaged with. The Deputy Premier is no different from any one of us in respect of that. You heard the Governor earlier note that we were going to have, I think he mentioned cabinet, but I will just confirm that I did take I took the step of inviting, making sure that all caucus members were invited to that. And that also included the Speaker, Mr. Bush, because he obviously represents a constituency in West Bay West, and he deserves to hear directly from the public health experts who have advised, the Public Health England experts who have advised a lot of the overseas territories, including BVI and Bermuda and Turks and Caicos, on the various issues that they have encountered in managing COVID. So that is a presentation which is going to occur on Monday, and every member of the government and also the Speaker, who represents, as I said, his own particular constituency, will be present for that, and that is, we're going to have a full consideration of all the various factors and get very clear advice with the assistance also of Dr. Lee and probably some of additional experts from the HSA, and we're going to have a full consideration of all the various factors, all the public health issues, to see where we come out, and people will have the latitude to ask the difficult questions, to ask questions that give concerns to them or their constituents, importantly. So this is something that, this is a very difficult decision. As we've said multiple times, His Excellency has certainly acknowledged that we do face a difficult decision, and he certainly doesn't envy the decision the government needs to make on this. But he's very supportive. We're all supportive of each other, and we're going to get through this together with the people of the Cayman Islands. This government is going to make the best possible decision to get us safely and guide us safely through this current public health challenge right now, as well as moving forward with our reopening plan.
Thank you. My final question is, in light of all the panic buying, what assurances can you provide the country of our supply chains?
Well, I think the various stores, the supermarkets, and I think certainly certain specific ones have been quite clear in their advice to shoppers. There is no need to engage in panic buying. They will have supplies available. I don't think it's a secret that around the world we have supply chain issues. It's, as I said, there's no secret about that. That has happened in the past. It is somewhat ongoing, and there are times when they have to change suppliers in order to get the products. But by and large, it's stable, and the pricing is, there's not an issue or concern around price gouging or serious inflation of these prices on these products. And individuals should take comfort in the fact that we have very well established businesses that do an excellent job and have served the Cayman Islands extremely well for a long time, and certainly have done an excellent job through the last 18 months, and I'm sure will continue to do so for the future.
All right, well, my only final comment is that I too took the jab, rolled up my sleeve
I am
today.
so proud of you. I am so proud of you. Thank you.
Thank you very much, Chandral, from the Cayman campus. So we're going to turn now to April Cummings, who's representing Radio Cayman.
Everyone. So in advance, I need to say that it's been difficult for me to hear, so I may have missed answers to questions that members of the public have asked me to ask. So please bear with me on those. One of the questions pertains to vaccinations, and the question was whether we are going to, or whether we are contemplating allowing vaccinations such as Sinopharm to be used, and would they be treated the same way as the Pfizer vaccine, for example? I think this is a Dr. Lee question, I'm assuming.
Yeah, thanks, April. Hope you can hear me. We've received guidance from Public Health England about what to do with people with different vaccinations. And certainly some of the vaccinations which do not appear as successful as others at protecting people, they have given a considered document which recommends different combinations and what to do in different combinations. For example, if there's been too long a gap, or if somebody started with one vaccination and you don't have that, what you do with a second, or if somebody's had this type of vaccination versus that type of vaccination, what you do. So it's a lot of different combinations, but we have a guidance document. And to distill it into a very short description, I might say that essentially it's often a booster of one of the other vaccines which we know to work well on top of whatever the previous course was.
If someone has more specific questions or they're concerned about this, not just for themselves, but really they want to make the case for consideration, how do they do that? What is the process? If I believe so strongly that X, Y, or Z is something that you should be considering, not you specifically, but I guess it is in this case you specifically, how would I do that?
I guess you could contact your, the decision about vaccinations was made by Cabinet, by the government. So I would recommend that you contact your Member of Parliament.
That makes good sense. Thank you very much on that one, sir. This one I'm not sure is your question, but having recently traveled and gone through the quarantine process, which was a lovely 5 days, one thing I noticed is that no one would know that I was in quarantine at home unless they knocked on the door and I shouted at them to go away. Are we supposed to have signage that indicates people are quarantining at residence or not? And we may have covered this before, but.
This isn't really not really a question for me. This is really a question for Travel Cayman, but maybe you might be happy with my answer. The reason that we don't require it is really for issues of personal privacy. It's someone's, you don't have to put up a notice. It's not reasonable to ask somebody to put up a notice saying I'm in quarantine. Some people do. So if you came outside my house, you would find there's a big chain across the gate saying in quarantine, keep out. So I think if I'm trying to be helpful to stop people from coming to the house, and on the off chance that they don't know that I'm in quarantine. So I think it's entirely reasonable for somebody to do it if they wish to, but for reasons of personal privacy, that has not been required.
So this leads to the next question, which I actually think in this case is more for the Premier in this instance, but it's on the same general topic. I did receive a call today from an elderly friend who asked a non-question, but a question all the same. It was about balancing the right to her safety over the right to privacy. How do we strike that balance? And I thought perhaps this might be one the Premier might address, having been a lawyer and whatnot.
What's the context of it when you say balancing?
Her concern is this very thing that either she has COVID and is going about the place, or someone else. It's because we do not know the status of each other, right? So I may have, COVID and have, snuck out of my quarantine facility. But her concern was really just about the balance of the rules. What rules do you make in terms of what information is publicly available versus what is kept privately for my own privacy, just like the quarantine situation. My concern was someone could knock on my front door and I, not thinking, open the door with the person close enough to catch something from me, as opposed to the state mandating that I put a big sign on the front. There's a balance there that has to be struck, and I'm just curious as to how we decide what that balance is.
Well, I think by and large, it's going to be based on, the science, the public health issues first. That's what's going to drive it. And then to the extent that we can compromise and preserve the privacy element without compromising too significantly the public health aspect of it, then, that's where we sort of find the balance. I've been in a situation where I've inadvertently gone to houses, or gone to someone's house and knocked on the door, and I've had them say behind the closed door, "We're in quarantine, we can't open the door." That's how it should happen. I mean, you've heard the explanation about why we try to respect people's privacy, and once those those protocols are followed, people should know that they can't open a door and talk to somebody through an open door. That's a breach of the protocol. But standing behind the door and saying, "Hey, we can't open the door," that's fine. And I think, once we have that balance between protecting the essential part of public health, then we can leave the rest of it, I think, in terms of people's personal privacy. And we leave it up to them to decide, as Dr. Lee has indicated, the extent to which they will say, "Hey, put another sign up, I'm not available to speak to you because I'm in quarantine."
Sorry,
lost your audio.
I could not hear if this particular question was answered. I know we're still doing a lot of work and research and investigating, but do we have any sense of how the individuals who are the cases of local transmission may have gotten it in the first place? It's a needle in a haystack, I'm sure, but I just wondered if there was any information that gave some idea at this stage.
Yeah, we all want to know. If we find out, we'll share it. But that's always the question with a potential outbreak: is you do everything you possibly can to identify the source, and sometimes you don't, either because it's evaporated, you can't detect it anymore, or because there's subterfuge going on for whatever reason, and that's something that we bear in mind all the time.
Have you learned anything through this process over this past 18 months that you might do differently looking back?
What, not take this job on?
I shouldn't laugh, but
no. I think you're to be serious. I think the most important thing, and this has come out from other countries, but I think in fact in Cayman we've done it relatively well, is to communicate with the public and to do it as regularly as the demand is there, and to try and feed the information to them whenever you possibly can. Sometimes we fail because we just don't, not enough time in the day. But that is the most important thing, to take the public with you on a difficult journey.
Thank you very much. I will pass it on to the next person. Thank you.
Well, April, if I may just add on to that question, because I think it's an appropriate time to say this. One thing that we have as the anxiety is happening amongst us is the reality that regardless of when we do what you call the opening, this type of situation will happen. I know it's stressful. I know people are anxious because we've been through so much comfort for a very long time. But like hypothetically speaking, we did this in January or we did it next year in July. Eventually, because the way COVID is, because the way the world is directing to say eventually we will have to live with this in some case, no matter when we do this, there's going to be a point in time where we open our borders and then somebody will have COVID. The Premier and this government has been saying for a long time, the most important thing for us to do is to protect ourselves by getting vaccinated. The good thing that I've taken out of this is that the persons associated with the positives are not ill from the virus. Even the patient is currently dealing with other complications not associated with the virus. So that can be good indications as well. This could be a good test run, hence the reason we've been telling people for a long time, get vaccinated. Because no matter when we do it, whether it's the 14th or not, and I want to make sure this is clear, it's not been decided, or if we do it in January, or if we do it in July next year, eventually this will happen. We as a country will have to go through this slowly, but together, informed about what we have to do. That's what we need to learn from this exercise today.
April, would you have any other follow-up questions, or is that it for you?
One just pop in about whether treatments are being recommended for people who are sick but not hospitalized, but I would presume the answer is talk to your doctor.
Yeah, I think that's correct.
Yes, absolutely, April. But I mean, once you've been diagnosed, public health are there and they're talking to you every day. And if they feel you need any assistance, they will provide it. So please be reassured in that regard.
Thank you very much. I appreciate it.
Thanks, April. So we're going to turn right away to Wendy Ledger from the Cayman News Service. Wendy? We're not hearing. There you are.
I'm doing Dr. Lee first. Dr. Lee, can I just clarify, was the third person vaccinated? I couldn't hear whether you said that or not.
Yep, don't know the answer to that one, Wendy. I'm sorry. I'm not sure if somebody else on the call will know, but I don't know.
But they're not sick or
No,
symptomatic?
They're not sick, no.
Okay, cool. They're probably going to be the Delta variant, but you're obviously not going to know that either, are you?
Yeah, I think very interestingly, you know, this we call it a forensic skill because it probably did come out of there, you know, or it's been used there extensively. But this forensic skill enables you to know whether that person was infected by the same virus, and indeed you can trace beyond that perhaps to see whether anybody else in the community or any of the other positives had the same strain.
Okay, so you'll be able to do that at some point.
Provided we have the evidence, because obviously I'm sure you'll remember that we can only do genomic sequencing on very strong viral counts.
Right.
So if somebody came in and had a much weaker count, which might still have been infectious, we may not have a sample of that strain in the lab.
Okay, I understand.
Wendy, can we just jump in? Sorry, Wendy, we've actually got our Medical Officer for Health standing by, Mr. Rodriguez, so we're going to turn to further comment from Mr. Rodriguez.
Well, I just want to confirm that the third case, he's unvaccinated, so he's not vaccinated.
So, Wendy, you're free to answer another question there. The Medical Officer for Health confirmed that the third patient was not vaccinated.
Okay, yes. I'm carrying on with the questions that probably affect either Dr. Williams or Dr. Lee. The next one is the issue of contact tracing. You're saying at the moment that you're not, can I just clarify that you're not seeing any signs of these people's contacts being travelers? And if so, can I just clarify how long back you're going in terms of them having no travel history, you know, that sort of term that you use? Does that mean they haven't traveled in the last week, 2 weeks, or beyond?
I can answer that. So when we interview everyone who is a close contact or a contact to the patient, we go back as far as we can. We have any travel history at all, but we're mainly looking within the last 2 weeks.
None of those 49 people have traveled in the last 2 weeks?
More than I would say, none of them have traveled within the last month.
Okay. So there is either that, because presumably they can't, you can prove that, can't you? So you can check that these people haven't traveled. So you don't have to just depend on their word, because Dr. Lee was talking about subterfuge. So I'm just checking whether that would be something that would be possible for people to lie about. Presumably not.
Initially, we take the word, but we have the method and the way to check with the relevant authorities if they had traveled or not.
Okay, so there's still a mystery primary or a mystery source for this outbreak.
Yeah, we have not been able to identify the primary source as yet.
Okay. Can I switch now possibly to, I think Mr. Whorms is there, Mr. Fabian, with regards to a question about the Cayman Airways protocols. We understand obviously that Cayman Airways staff are potentially exposed to the virus every single time they fly. So we understand why I think some people were a little bit upset that they haven't been put in quarantine during this particular situation where they know for sure that there was a positive person on the plane. But can Mr. Fabian just explain what those protocols are for CAL staff when they finish a shift and how often they are tested?
Okay, thank you, Wendy. Specifically, you would be speaking about our flight crew, which is the cockpit and the cabin crews. The cockpit crews are kept isolated from the passengers at all times, so that mitigates the risk of any exposure. When it comes to the cabin crew, from the onset, our established procedures including the discontinuation of cabin service and essentially zero contact between the cabin crew and the passengers. So the cabin crew are, of course, there for your safety. So should there be an emergency, then they will intervene and there will be contact. At that point, there are protocols which will require them to go into quarantine and for public health to do an assessment of the overall situation, whatever it might be at that time, and decide what happens. In this particular case yesterday, where we had one passenger on board, which is essentially known to be positive, if we go by the result, the test result that was provided, then the mitigations to protect our crew from exposure to that passenger were inherent. They existed from the onset. Every single flight that we have, there is a chance that someone will be COVID positive on that flight, on an inbound flight. And our flight crews are protected at all times. They're protected by personal protective equipment and social distancing and the whole issue of maintaining no service so that there is no interaction with the passengers. This situation was assessed by the public health officials yesterday before our crews were allowed to be cleared, and the decision was that they did not have any exposure that was over and above what they normally would have had in the first place.
The crew, the cabin crew.
Sorry, speaking over Wendy now. Sorry, Wendy, go ahead.
How often is cabin crew tested?
All our cabin crews are vaccinated, and as frontline workers, even though it's not mandatory, they're tested on a monthly basis at this point.
Would those staff that were on that flight be tested now?
Public health has essentially cleared them, so there is no reason for any such testing.
Okay, thank you. I think that's all I've got for you. Thank you very much.
Wendy, one part that was not mentioned is that they also wear a mask while they're on the plane. So the PPE, the social distancing, no interaction, and a mask. So just thought I'd clarify that part.
Thank you. I think this might be a question for the Premier, which is, can you name who's on what's been referred to, I think it's the programme panel or the advisory panel that is helping government with all these decisions. Can you tell us who's on that panel?
Wendy, I can probably do a fairly decent job with that, but we have in studio the very able chairman of the program board, who is none other than our esteemed Deputy Governor, Mr. Frans Madison. So he will be happy to fill you in.
Thank you. Good afternoon. The program board, which I am really honored to chair, who has been in existence now for many months, we have a great cross-section of our public service. So obviously we have Dr. Lee and Dr. Samuel Rodriguez, along with Ms. Lizette from our HSA, and also other doctors as well. We also have members of my office, Ms. Rodriguez. We also have a number of chief officers who have responsibility for health, Ms. Pucci, for tourism, Mr. Borden, for border control, Mr. Wesley. We also have Mr. Eric Bush as well. And we have a number of other civil servants. So someone from our comms team, we have persons from other areas of the civil service that are required. So from time to time, we will co-opt persons on the board. So when we started to talk about reopening, so a lot of our time was actually spent looking at keeping people safe and making sure that Travel Cayman operated at the highest level. But as we began to transition to reopening, then we brought on persons from our Airports Authority, from Cayman Airways, from civil aviation, from tourism, and other areas, so that we had the best available talent and persons who could give us advice on various aspects of reopening. I don't want to make it clear, and I think some people believe that the program board develops a policy, gives it to the government, and they accept it. That's not the case. If you know the persons that you've elected, you will know that they're not scared of asking questions. And when the program board develops a policy that we believe we should put forward to the government, we are tested, and rightly so, because they want to make sure that we have thought through any of our recommendations or advice. So we get drilled by members of the panel who want to know that we are giving them the very best advice. And we welcome that scrutiny, because that keeps us sharp, and that makes sure that we are doing our best to give the most up-to-date advice, and also advice that has been taken by collaboration, talking with people across the entire public service. We also spend a lot of time listening to the tourism sector. So Ms. Rosa Harris and Ms. Strand Borden are our contacts with members of the private sector. From the tourism, we talk to Minister Bryan as well, to make sure that we understand what the private sector is thinking. The governor always says to me, DG, we want to make sure that there are no silos in the civil service. And I am very proud to say that I think the program board is by far one of the best examples that I've seen of where we have broken down silos, everyone working together for one common cause, and that is to give the government the very best advice we can to keep all of us safe.
Thank you.
Mr. Madison, can you just say who the other doctors are besides Dr. Lee and Dr. Rodriguez?
Yes, Dr. Simmons, our own Caymanian doctor, who does a fantastic job giving us some really great advice. She's really a powerful force.
Is that it for health people?
That's correct. Of course, Dr. Lee's there, and he consults.
Yes.
Okay, thank you. And Dr. Lee's there, and he makes sure that he then obviously consults with Public Health England and other doctors as well.
Okay, so they are consulting still with Public Health. This isn't a one-off with the Zoom this week. They have been consulting with Public Health England.
Absolutely. That has been throughout the entire pandemic.
Thank you. The next question I have really, I think, is going to be for the Premier. Or there's two questions for the Premier. Good evening, Mr. Premier. The on Saturday evening, Dr. Tomlinson, as you know, he's a very popular and well-known figure here in the community, is joining some of the anti-vax group for a public meeting on Saturday. Amidst all this, I'm not sure whether that's still on now, given the sort of situation, but can you comment on that situation with a doctor, such a well-known doctor, taking a sort of different position from the sort of received wisdom about vaccines?
Wendy, I think it probably would be unfair of me to sort of express a particular opinion at this point, given that I have seen, the only thing I've really seen from him in terms of direct communication from him is an expression of concern around the vaccines that have been approved, and perhaps some sort of complaint that there's only one sort of person who makes the recommendation as to which vaccines to approve. I haven't heard personally any specific positions that he advocates. In a general sense, I have certainly heard that he does not support the Pfizer vaccine that we utilize. I do not know specifically why. As I said, I've never heard him articulate an argument against it. In a general sense, again, I'm disappointed that we have anyone who, particularly a doctor who would sort of recommend to people that we not utilize a vaccine that is very widely recognized as having a really high efficacy, and obviously now has full federal drug administration in the U.S. Approval. So the arguments that I've heard in the past was that this was this particular vaccine, or I think probably more broadly any vaccine associated with COVID, were sort of experimental vaccines and that sort of thing. That argument should have fallen away at the time that, completely fallen away at the time that there was full FDA approval. To the extent that that is still continuing, then obviously that's a disappointment. The advice that we have had from Public Health England, from what we've observed around the world, the U.S. is utilizing Pfizer as much as they can. This is a very strong tool, and really the only real tool that we have to protect the people of this country. We know that the vaccine, and like many vaccines, perhaps, is not infallible in the sense that it doesn't provide 100% protection against infection. But it does provide significantly better protection than somebody who is unvaccinated. It also, it's very clear from the data from the various studies that were carried out, and also, observation of situations around the world, including specifically in the Caribbean and our own overseas territory colleagues. People who are vaccinated, and including those using the Pfizer vaccination, do much better. They get less ill, and there's a far lower incidence of death. So the government's position is this is the vaccine that we have obtained from the UK. It is being given to us for free. It is endorsed. It is approved. Why would we not? Why would any responsible person not want to utilize this as the main tool to help the people of this country? It is difficult for me to understand the arguments that are put forward against it. Obviously, people have, they can have their own reasons, and sometimes it's based on religion or something else. But in this case, it seems to me that there is an argument about the medical aspects of it, and that's sort of difficult for me to understand. But we'll have to see exactly what the arguments are that are put forward, and how they present their perspectives. But obviously, I would rather they support the government's position and try to encourage people to get vaccinated rather than the other way around.
Thank you for that. The other question I have is, the opposition leader was taking to task a little bit yesterday on the fact that you haven't been keeping them informed. I was just wondering what your comments are about that. Like, for example, would you be inviting the leader of the opposition to join that Zoom call next week, or anything like that? What's your position on how much you should or are obligated to keep them informed, and for what reason?
I think you're referring to a statement that was made that they'd like public health. I think what was said was they were going to ask public health to provide them with information and with a briefing. I think that's absolutely fine. There's no reason why that can't happen. I think for us, in terms of this particular situation, there will be a discussion by the various members of government, which is not really going to be conducive to having people from the opposition sitting there and listening and engaging in the same discussion. But certainly, there's no problem if they ask for further briefings from public health. I'm not aware of them having asked previously. So this is an issue that has just recently been raised by this comment. I would think that we could certainly accommodate that request.
Okay. Lovely. That's all I've got. Simon, thank you very much.
Thank you too, Wendy. So now we'll go straight to Ms. Sandy Hill from Cayman Mall Road.
Hi, good evening. Just a couple quick questions from some CMR listeners. The first one is, in light of the Miss Cayman Universe pageant being canceled, can we expect the government, because there's quite a number of concerts that will probably have more persons in attendance than the pageant itself, will those particular events be permitted to continue at this stage? And are there any sort of protocols being put in place in terms of mask wearing, vaccination requirements, or anything else?
Well, we haven't had any discussions about mandating any more rules further than that. As you know, Miss Cayman Universe is under a government brand. And to be honest, you have been asked to let it go on. But I think I'd rather take the cost of a delay than anything happen. It's like the old saying goes, it's better to be safe than sorry. So yes, maybe we're being extra precautious here, but I assure those persons who are planning to come, and the contestants and the committee and their family members, that the ministry will put a little bit something extra in there for the delay so we can all have fun. But as per any other event, the government hasn't taken a position in that. It's just that it'd be best for a government branded and supported and sponsored event to take the necessary precautions.
Okay, thank you for that. There have been a lot of concerns about the 52 breaches that occurred last month. And there are persons who are wondering if we couldn't have something more effective in place, such as real-time reporting of quarantine breaches. That's the first question, I guess. And then the second part of that is whether or not anyone has been fined the $10,000 in relation to actually breaching any of the regulations related to COVID-19.
I think just on that question about the breaches, I mean, there are 2 cases coming to court next week, so I think the system is working. One challenge with this, of course, is that you can't really investigate until the quarantine period is over. So there's always going to be a bit of a delay, but The system is working. The police are investigating any. The 52 that were mentioned were suspected breaches. When they were investigated, that number reduced significantly, and cases are coming to court. So I think the system is working. But if people have ideas of what could be done differently, I'm sure we'd be willing to look at them.
Yes, Sandy. I mean,
and then are we aware? I know we've had a few, prison sentences, but maybe for some people, a stay at Her Majesty's Palace might not be a deterrent. Has there been any monetary fines that we're aware of around the $10,000 mark?
We didn't follow that, Sandy. You want to repeat that last bit?
Just wondering about whether or not anyone, I mean, I certainly can't recall whether anyone has been fined the $10,000 as opposed to a week or two in prison.
No, I don't think anyone has been fined $10,000, but of course this is up to the courts. This is not for government to decide. We have an independent judiciary, and we obviously respect and abide by their decisions.
Yeah, I mean, when in terms of the regulations, when they say 2 months in jail or 2 years in jail and $10,000, that gives a wide discretion to the judiciary, and they have guidelines that they operate by in terms of sentencing. So we certainly, I mean, a $10,000 fine would be like the absolutely most extreme, most egregious sort of scenario, and that we obviously haven't had anything like that. And going back to your, Sandy, just going back to your other point in terms of real-time reporting, I mean, the governor's made it quite clear that these things have to be investigated, and I think what that reflects is that these are not sort of binary things. It's not either or. There are lots of complex scenarios possibly, so they have to do a full investigation, and so there may be an indication of a breach, and they do some preliminary investigation of it and conclude, without actually having to do a full investigation, that there was no breach at all. That has happened even fairly recently. So, it doesn't make any sense to try to report these things on a rapid basis without doing the job properly of assessing whether they actually reflect proper breaches, and doing justice to a proper investigation.
Premier and Sandra, if you would allow, I think this is a perfect opportunity while the topic is at hand to say that there is a breach hotline which the public can call to report any suspected quarantine breaches, and that number is 943-7233 or 943-SAFE. The hotline is being monitored all the time, 24 hours a day, 7 days a week by Travel Cayman.
Thanks for that reminder. I think that was quite important because a lot of us have forgotten that. Just one final question in terms of breaches. The situation with Cayman Airways yesterday was particularly concerning. But I've received a lot of complaints that taxi and bus drivers are not following the proper protocol. And I guess this goes back to people, obviously reporting those things. But can there be any additional sort of enforcement of those specific to taxi and bus drivers? And speaking of taxi drivers who are actually picking people up at the airport and taking them to their quarantine destination.
I didn't think I heard the whole thing in its entirety, but I think you were talking about violations in respect to transport companies, either taxis, tour bus drivers, and the like. I agree with you. Yesterday at the press briefing, I think it was Andrea Harris that spoke about the local bus drivers not meeting protocols in respect to mask wearing on the local buses. It is a concern for me, and I've had a discussion with my CEO about having a talk with the director of transport, sending out a memo of a reminder, and if they are found to violate those, particularly those are the operators of those vehicles and transport systems, that they are in breach and could potentially lose their license to operate. Safety is something we take very seriously, and we will be sending that memo out hopefully sometime on Monday.
Thank you very much. That's all for me.
Well, thank you very much to you, Sandra, as well as the other members of our the journalistic fraternity, and for those questions that we got. We do actually have one question that came in from a member of the public, and it's somewhat a bit like a statement, but if all persons who are to be vaccinated get the vaccine, how do I protect my 7-year-old grandson who has a heart condition? And then the statement that phase 4 should be compulsory quarantine and PCR tests upon visits to the islands. And this person notes that they've been vaccinated since May. So I think the question here is what's the plan to protect children once we reach the target vaccine rate?
Probably
I don't know if that would be
Dr. Rodriguez.
Dr. Samuel Rodriguez or Dr. John Lee is still on the line. I see Dr.
Yes.
Rodriguez is stepping up too. Okay, Dr. Lee. Thank you, Dr. Lee.
I think we have to bear in mind the chances of a child getting seriously unwell. They're vastly different to the chances of an adult, such that, and sorry to have to talk about death, but the chance of a child dying from COVID is something in the order of 1 in 500,000. The chance of a child being admitted to intensive care is something in the order of 1 in 40,000. That's if they get COVID. We only have around 9,000 children in that category who can't be vaccinated, under 12. So, we're looking at exceedingly small chances because children do so well, and that remains a fact that children are doing very much better than the older age groups. So we can be reassured in that fact. It still remains the case that the more people are vaccinated around the children, that's how we protect them. I think partly, if I heard the statement, Simon, correctly, it is the case that we are currently requiring all visitors to the island to be vaccinated. You can't come here if you're not vaccinated as a visitor, as a tourist. So we do have that protection as well. Additionally, we will be rolling out plans to do much more widespread screening, including, of course, in schools. And that will additionally help to protect so that if we know that there's an issue, we can act on it quickly. I'm not sure if Dr. Williams has further to add.
I think that was good. Thank you very much, Dr. Lee, for that response as well. So that really concludes the question time. I don't know whether the panel, we've got possibly some questions that have come to the ministers or the governor while we've been going through the press conference. Also, just want to take the time to thank our sign language interpreter, Ms. Carolyn Powell, who worked so very hard, and acknowledge the contribution from the Deputy Governor, the Honourable Franz Manderson, earlier on. But I'm going to turn now to Minister for Health, the Honourable Sabrina Turner.
Thank you. I've just been updated with some statistics or some numbers from the Cayman Bay vaccination clinic that's ongoing this morning. And so far from the stats just received, there's a total of 290 persons that were vaccinated this morning. That is still ongoing. And of that 290, there were 230 first dose that were administered and 60 second doses. And also from Cayman Brac, they have joined into this vaccination drive, and they're putting on a vaccine clinic on Wednesday, September 15th at the Aston Ruddy Center from 9 a.m. to 1 p.m. So I want to encourage persons to go out and get vaccinated, even in the sister island. And as they continue down at Cayman Bay, those numbers are looking great. I understand that the queue is still pretty long. And if you don't get through this evening, go back there tomorrow from 10 until 2 and from 4 until 7:30. Remember, the flu hotline is also open, and the flu clinic at HSA opens officially on Monday. That is from 8 a.m. to 4, and you follow the sign. We're asking all persons to be reminded that even the visiting hours and visiting protocols at HSA has now changed. It's one visitor per person, and we're asking persons to make sure that when they go to the HSA that they walk with a valid photo ID, and don't forget to bring your own mask. Flu hotline number, again, just quickly, 947-3077 or 1-800-534-8600.
Thank you very much, Minister Turner. Any final comments from Mr. Bryan?
Yes, I do have one. I just want to thank the CEO for Cayman Airways and the chairman for my board for assisting me so much last night as we were going through that unfortunate incident at the airport. For ministers, the first time I've had a serious incident under my responsibilities, and it was a pleasure to work with them trying to get the information necessary for the people. So I just want to send them a thank you.
Good. I want to thank everyone who joined us. I want to thank my colleagues here and His Excellency, our Deputy Governor and others in the studio still. I think we've had a good discussion, and I'm looking forward to having some additional information to report early next week, and we will advise and confirm the time for the press conference. I've been referring to that as 3, 4, 5 these days because I don't know whether it's going to be 3 or 4 or 5, but obviously, as I indicated earlier, we're delaying it because we want to get as much information from public health as possible, because that's our role in informing the public. So thank you all very much again, and I want to say have a wonderful weekend. Take care. Stay safe, Cayman, and we will get through this together.
Thank you very much, Honourable Premier. And that now concludes the Cayman Islands Government COVID-19 press conference. And as the Premier said, we wish you all a very safe weekend, and please get vaccinated if you haven't been already.